Again, I'm Antje Petty with the Max Kade Institute, and our speaker tonight is our director, Mark Louden, who many of you know. He's also a professor for German linguistics, and he will say a little bit more about the research he does. His focus is on Pennsylvania Dutch, the language, and he's also the co-founder of the Pennsylvania Dutch documentation project at our institute.
All right, sounds very good. I'm very grateful for so many people showing this evening. And Antje, thank you so much for managing everything and introducing me. As Antje indicated, I'm the director of the Max Kade Institute for German American Studies. I've been a faculty member at UW-Madison now for 25 years. My primary appointment is in the German program within the Department of German, Nordic, and Slavic Plus. As Antje indicated, I'm a linguist by training. I focus on the Germanic languages, Pennsylvania Dutch in particular. I'll be talking about some language questions in my presentation shortly. I'm also affiliated with the Center for Jewish Studies, the Religious Studies program, and our Language Sciences program, which is our linguistics program here on campus. And what I'm going to be talking about this evening is not necessarily connected to my research and only very indirectly to my teaching, but really to my service and outreach. I'm going to be talking about my outreach work that has its roots going back to when I was in graduate school 40 years ago, a long time ago, and through my first teaching appointment, which was from 1988 to the year 2000 at the University of Texas at Austin. And but really kind of ramped up since I joined the UW-Madison faculty in 2000. And so I'll be giving you a little bit of personal background with that. So I'll start sharing my screen now. And again, as Antje indicated, I will be happy to answer any questions that you might have at the end of my formal presentation. So let's make sure we've got our slides going here. Hopefully you should be able to see my slides okay and hear me. Any questions again that you have along the way, please put them in the Q&A and Antje will curate them at the end. So the title of my presentation this evening is Building Bridges, Interactions Between Plain and Non-Plain Communities. And I'm going to start off with a roadmap of my presentation this evening. I will be sharing a little bit of information about my personal/professional background that has led me to the topic this evening. I'm going to give you an overview on the groups that I work most closely with here in Wisconsin, but in many other states as well, folks that are referred to as plain Anabaptists. And the term plain may be familiar to some folks, but I'm anticipating that's unfamiliar to others. And probably the term Anabaptist is also not necessarily familiar to everybody. The shorthand is that these describe groups like, for example, the Amish or the Old Order Amish, as they are formally known, and smaller groups of traditional or conservative Mennonites. But I'll be giving you some specific information, definitions about plain Anabaptists in just a moment. I'll be talking about Anabaptist beliefs generally. I myself am an Anabaptist. I'm a member of a Mennonite church here in Madison, Wisconsin, although we're not a plain Mennonite group, and so I'm not a plain Anabaptist. But all Anabaptist churches share certain core beliefs with one another, and I will indicate how these core beliefs, specifically for the plain Anabaptist groups, kind of translate into lifestyle, sort of how they affect or in some cases determine the interactions between plain Anabaptists and their outside neighbors. I'll be focusing on two areas of activity in my outreach work, the first being healthcare. Most of my experience in terms of public outreach over the last 25 years really has been in the area of healthcare. I serve as a medical interpreter for UW Health formally. So that means that I'm, shuttling back and forth between one side of the campus and the other, but I do a lot of outreach work related to healthcare across the state. I'm going to be sharing some insights with what I call plain health culture. Sort of basically kind of cultural aspects about about understandings of health and well-being, how plain people understand health and well-being in a general sense, and how they understand maintenance and restoration of health, and how they access healthcare systems, both within their communities as well as externally. And then I'll be moving towards some insights that I'd like to share about how communication between plain people and healthcare providers may be improved. Then the second major area of activity that I'm going to be talking about this evening has to do with interactions between plain people and, broadly speaking, the legal system. So that would include the court system, that would include law enforcement, the correction system. Also, it's not as common, but there are interactions, points of contact there between say, departments of correction and plain people. I'll be talking about how communities themselves, plain communities, have structures in place for addressing civil and criminal cases that involve their people either as victims or, in some cases, rarely, but on occasion, as offenders. And then, similar as what I've done with the second point under healthcare, I'll be sharing some insights about how specifically one particularly tricky area of interaction, namely in criminal cases that involve domestic and sexual abuse, how these cases these situations can be addressed through partnerships between outsiders or outside organizations and plain communities, and how what I would call a culture of prevention may be fostered. And I'm going to be having a particular focus on the concept of forgiveness. Forgiveness is a term that's widely familiar in culture generally, but there are some very, very specific aspects about how forgiveness is understood by Anabaptists and plain Anabaptists in particular that I think is relevant to understanding how they interact with the legal system. And then I'll wrap up with some concluding thoughts, kind of tying insights together between these two spheres of activity of mine, healthcare and the legal system. Give you a little bit of autobiographical information. It's been now exactly 40 years. So it was 40 years last month was my first contact with plain people. And it was in 1985, February 1985, in Romulus, New York, which is a small community, an Amish community that's located in the Finger Lakes region of central New York, where I first attended an Old Order Amish church service. And that got me sort of on the spiritual odyssey that I've been on for the past 40 years now, which has led me to eventually becoming a baptized member of a Mennonite congregation. But at that time, I had not been raised I had no formal church background, but I had been, since my sort of early teenage years, had been visiting a lot of different churches through friends and family, that sort of thing. And as a college student, actually my first year of graduate school, I was particularly drawn to the Anabaptist expression of the Christian faith. And the closest Anabaptist congregation to where I was, which was Ithaca, New York, was the Amish community up in Romulus. And so I went up there, made the acquaintance of a family, and I asked if it would be permissible for me to attend their church service. And they said, "You're the first person that's ever asked in this community," and said, "Sure." And I already knew German at that point. I was in graduate school being trained as a Germanic linguist. But this was my first exposure to Pennsylvania Dutch. And it was very practical already from the very, very first church service in February of 1985 that I attended. The community assumed that I could understand everything because I knew German. And then I understood a lot, but I certainly didn't understand everything. And so I was able to learn Pennsylvania Dutch by immersion. So whenever I didn't understand something in Pennsylvania Dutch, rather than just switching into English and translating it for me, people would just rephrase things in Pennsylvania Dutch. And so that was an ideal way for me to develop the knowledge of the language through immersion. About 6 months after I'd made that first visit to the Amish community in Romulus, I made the acquaintance of some Old Order Mennonites who are located also in the Finger Lakes, but one lake over near Keuka Lake, which is 2 lakes over from where I was in graduate school at Cayuga Lake. So Yates County, New York, Penn Yan is the county seat there. And in Yates County, I started spending a lot of time with the Old Order Mennonite, horse and buggy driving Mennonite community there. Started, quote unquote, running around with their young people. It's not as wild as it may sound. And then for 2 years taught singing school in Pennsylvania Dutch for their young people. And then attended church there and learned how to operate horse and buggy and just really, really grew as a person, and including spiritually. My first teaching assignment or first teaching position was I started in 1988 when I had completed my graduate degree at Cornell, and I taught at the University of Texas at Austin. And as good fortune would have it, there was an Amish community, a small but active Amish community, located about 55 miles south of Austin, near the small community of Gonzales. And so I actually attended church there for the next 12 years and lived for the last five actually on a ranch that looks very, very similar to the buildings that you see here. It was taken from the same highway. The actual dwelling that I lived in no longer stands, but this was like basically two ranch houses down from where I lived. And I attended church there, as I say, for 12 years. Um, so turning now to specifically my healthcare and legal experience through outreach, very much in the spirit of the Wisconsin idea, which I'm incredibly grateful to have that support from institutional support through our mission here at UW-Madison and across the universities of Wisconsin. So pretty much starting when I came here 25 years ago, I started getting involved in translation, which is basically working between two or more languages in written form, and then interpretation, which would be more oral use of language. And I started doing it sort of informally and then much more formally in a certified way to be able to translate between and interpret between Pennsylvania Dutch and English. And my activity in translation and interpretation today includes these four major areas of activity. So I serve as a medical interpreter. I indicated that I'm officially a part of, as a volunteer, of interpreter services through UW Health. That brings me into contact with plain patients and their families at the University and American Family Children's Hospital. But I do visit patients in other hospitals in Madison and elsewhere. I also have served as a certified court interpreter in Wisconsin and actually several other states. And I've also served as an interpreter in forensic interviews. Forensic interviews are conducted by social workers or child advocates when there is a suspicion of typically sexual abuse. And so I've learned how forensic interviews generally are conducted and have served as an interpreter. And then a very interesting sort of aspect of my language-based work is the translation and analysis of recorded interviews with victims and in some cases suspected offenders of crimes in Pennsylvania Dutch. And on three occasions, recordings of phone calls made between Pennsylvania Dutch speaking inmates and outsiders, or people typically in their community. So in one collection of recordings, it was actually literally hundreds. They were made, there were calls, outgoing calls that were made from a jail to family members over a year and a half, and there were multiple calls per week. That was a very, very considerable amount of work that went into the the translation and analysis of selected calls there. Aside from my language-based work, I do several presentations, public-facing workshops, and in-service trainings for professionals every year. It's on the order of somewhere between 30 and 40 separate events every year, so it keeps me quite busy throughout the year. A lot of these presentations are to healthcare providers and to students, especially nursing students and medical students. I'm also affiliated with the Wisconsin Academy of Rural Medicine, which is a cohort within our School of Medicine and Public Health. I serve on their admissions committee now as the second year, and I work very, very closely with one group of students that are part of that warm Wisconsin Academy of Rural Medicine cohort. And I also do a lot of work to supporting community health workers. I also have a lot of wonderful interactions with social workers, child advocates, and counselors and therapists. Work also with law enforcement and corrections professionals. Just got an invitation from the Wisconsin Department of Corrections today to do a Zoom presentation for an 8-county region sometime later this spring. And then finally, I do presentations to various government agencies. So, for example, departments of health services, agriculture, the DNR, natural resources, and also the National Weather Service. So let's, talking a little bit about some of the specific experiences that I've had in both healthcare and legal, some of the areas of healthcare that I've had particular I've developed a certain amount of knowledge and worked with providers that have a specialization in these areas. Um, Not surprisingly, if you know anything about sort of plain communities, you may be familiar that they are closed communities, meaning that plain people intermarry only within the community. The first thing that people think of when they think of, say, the health consequences of being a member of a closed community is that there may be problems with genetic disorders. And that's certainly true of all traditional communities, all closed communities. In fact, all human populations are susceptible to certain genetic order disorders. And plain people are no exception there. So have a lot of outreach work that's connected to various inherited or genetic disorders. One particular one that it has been documented in Wisconsin Amish communities over the last, say, 15 years or so is known as SCID, severe combined immunodeficiency disorder, known as SCID, also known as bubble boy disease. And basically, it's something that a baby is born with that effectively means that their immune system is either severely compromised or almost not at all working. And really, the only therapy that's available for that, really for survival, is a stem cell transplant or bone marrow transplant. There is some exciting research that's going on worldwide, including outside of the United States, on potential gene therapy for certain types of SCID, but it's not something that is part of the options for treatment so far, and including the types of SCID that Amish people might be susceptible to. The second major area of healthcare that I've been working with and I've been very, very deeply committed to advocacy for is an Amish developed therapy, alternative therapy for the care of burns and severe wounds that's known as the B&W, stands for burns and wounds for a particular salve, burdock, as in the burdock leaf, right? The burdock plant. The B&W burdock therapy. I'll be talking about that in a moment. Some really, really exciting scientific research that is sort of supporting the anecdotal evidence to show that it's a very, very effective alternative to the standard of care for the treatment of burns and wounds, including pain management. Immunizations, the vaccine question. This is a very, very tricky question. I'll be talking about a very, very current case that I'm not directly involved in, but does deal with the plain community and vaccine skepticism or vaccine hesitancy. And then there are a number of kind of almost random or sort of idiosyncratic different kinds of situations, healthcare-based situations that I assist in for either individual patients or their families. One of the more striking situations I was involved in was retrieving a severed limb for a patient who had lost it for a certain amount of time, and I was able to locate it and get it returned to him. This is a story that we may want to follow up on in the Q&A if you're interested. In terms of legal cases, a lot of my work involves mediation between families and plain communities on the one hand, and attorneys, often public defenders, social workers, the court system, parole and probation officers. I often serve as an expert witness, be coming up one here in Wisconsin in the spring. Again, most of the cases that I'm involved in are civil cases, so things having to do with things like building or zoning, like county zoning or town zoning regulations, things having to do with insurance or road safety, so things like vehicle and buggy accidents. But I am also involved in certain criminal cases, and because they've gained a lot of attention in the popular media, specifically cases that involve domestic and sexual abuse, that's one thing that I do want to focus on in my presentation. But I will not be sharing specifics about any particular case that I've been involved in. So some background information about who Anabaptists are. The Anabaptist family of churches includes four major branches. So the Amish, going from right to left here, the Amish, various Mennonite churches, so-called brethren churches, historically referred to as the Dunkards, because they practice historically full immersion baptism, and then a communal group known as the Hutterites. I'm going to be talking mostly about the largest plain Anabaptist group, the Amish, as well as some smaller Mennonite groups. But if you kind of cast your gaze to the top of that arc there and you notice the year 1525, hey, that's 500 years ago. Yes, this year, 2025, is the 500th anniversary of what is known as the Anabaptist movement. And there are numerous commemorations ongoing in North America and really worldwide. The symbolic beginning of the Anabaptist movement occurred on January 21st, 1525, in the city of Zurich, Switzerland. And this is a view taken from a website, Anabaptism at 500, from the very, very heart of Zurich, Switzerland, where there will be a special day, May 29th, of sort of a gathering of international gathering of Anabaptists in Zurich to get together for a number of events commemorating the 500 years of the Anabaptist movement, and I have the good fortune to be able to be there. So this chart shows you in a fairly simplified form, sort of who plain Anabaptists are versus non-plain Anabaptists. And basically, plain is shorthand for Christians who dress and groom themselves in a sort of modest, or at least at the very least kind of distinctive way that's out of sync with mainstream fashions. Plain people also typically limit their use of technology in sometimes practical and often symbolic ways. So most Mennonites worldwide are non-plain. So like, for example, the church that I belong to here in Madison is a non-plain Anabaptist congregation. Mennonites are spread throughout the world, including the global south, and the vast majority of Mennonite congregations are non-plain. So you wouldn't be able to look at a Mennonite and just by their dress or grooming, identify them as being a member of a particular Anabaptist church. But there are some Mennonites who are plain dressing. There are Old Order Mennonites who are represented here in Wisconsin. Mentioned them before, the group that I was affiliated with in Penn Yan, New York. They were Old Order Mennonites. Low German speaking Mennonites, who I'll talk about again in just a moment here because there's a kind of a timeliness to their communities. All Amish are considered plain Anabaptists. There are no non-plain Amish. The Hutterites that I mentioned before, a communal society whose folks are represented about two-thirds in the prairie provinces of Canada, and then the other third in the two Dakotas and Montana for the most part. And then so-called traditional brethren groups. Most brethren groups are not plain, but there are some more traditional brethren groups, like, for example, the Old German Baptist Brethren, who are also represented here in Wisconsin in small numbers, who dress plain and are distinctive. I'm going to go back to the group there, the Low German Mennonites. There are a number of groups of very interesting, complicated historical origins who came by way of Russia, although they didn't originate in Russia, and they speak a form of Low German. Many of them speak Low German, and they're distributed throughout the Americas, including several in Latin America. There is a group of Low German speaking Mennonites who have been in West Texas for about 50 years now. And unfortunately, they are at the heart of the measles outbreak. So in Gaines County, Texas, which is sort of ground zero for this most recent measles outbreak, current count something like 200 people infected, the vast majority of whom are Mennonites. And there have been 2 deaths to date, and one of whom was a Mennonite child. So that's from the Low German speaking Mennonite community. Not all the stories highlight the fact that the center of the outbreak is this Mennonite community, but that is the case. So what are the core beliefs among Anabaptists, and how do they translate into the ways that they interact with folks like healthcare providers and the legal system? So Anabaptists, like like Protestants, and Anabaptists technically are not Protestant, but we share a number of things in common. One is that your doctrines should be grounded in the Bible, right? Rather than, say, in the teachings of a particular institution or individual. So Anabaptists look to the Bible for their primary authority of doctrine. Our churches practice what's known as believer's baptism. So basically, when you are at an age to make your own decision about whether you want to enter into a formal covenant with a local congregation and a relationship with God, signified by the rite of baptism. That would be sometime around kind of like teenage years. Typically in Mennonite congregations, it's sort of like would be for folks that attend high school, late high school. In Amish and Mennonite communities, it's maybe around 17, 18, 19 years old, which is a typical average age for undergoing the rite of baptism. Something that was considered radical 500 years ago, but not particularly radical today, especially in the United States of America, is the belief that church and state should be separated from one another. Our churches, all Anabaptist churches, are so-called historic peace churches. So we're kind of pacifism plus. The doctrine that we look to is what's referred to as non-resistance. So not fighting back when we are confronted with violence. We can defend ourselves, but just not in a violent way. And that's grounded in Jesus' injunction to not just love the people that you have affection for, but also to love your enemies. Anabaptists also believe strongly in kind of walking the walk. So the idea that your everyday life, your values, the way that you live your life should be in line with your principles. And so discipleship is the kind of watchword here. And plain people in particular would say like the kind of main virtue that they strive to uphold in their everyday lives is humility. Nonconformity is something that's quite visible among plain Anabaptists, and this is partly the reason why plain Anabaptists choose to mark their identity outwardly by dressing and grooming themselves distinctively, and also with the limitations on technology, for example. It comes from a doctrine that believes that Christians should be somewhat out of sync with the social mainstream, sort of a minority everywhere. Not so much physical separation from the rest of the world, but more from the concept of worldliness. And then finally, Anabaptist churches, especially the plain Anabaptist churches, kind of look to the early church. So, like as described in the book of Acts in the New Testament, as a model for congregational life. So, stressing kind of members of a brotherhood. And what this all translates into across Anabaptist communities, but quite in a very articulated way among plain Anabaptists, is that there's this culture of that kind of de-emphasizes individualism. So it's a culture of community, of self-reliance as a community, but not in an individualistic way. So kind of relying on your community and your fellow brothers and sisters, rather than say, the government. Being accountable to one another, practicing forgiveness, and what I call a culture of care or care for others, which is expressed also in programs of mutual aid. So thinking about sort of Amish health culture or plain health culture generally, I'm going to be talking mostly about the Amish here as the largest plain group. There's some very interesting aspects of plain health culture that go back pretty much 500 years. This is an image that's taken from the Emma Valley. This was not a professional photograph. I actually took it with my phone one of the times that I was in Switzerland. And this is this incredibly beautiful view in an area where many Anabaptists of Swiss origin derive from, so including many Amish folks. And what's very interesting is that in the historical record, there's a very, very strong connection between Anabaptism or Anabaptists as individuals and the practice of medicine. So practicing, care for humans, but also veterinary medicine. And I've got one quote here that talks about Swiss Anabaptists that was published originally in French, and this is a translation here, talking about sort of typical occupations that early Anabaptists had in Switzerland and adjacent countries. Say, surprising as this may seem at first glance, medicine was an Anabaptist specialty. And there's still a very, very strong kind of interest on the part of a lot of plain people with health and well-being and the practice of medicine. Um, on the far right of this slide here is the title page of one of the more famous Swiss published herb books, Kräuterbuch, right? That's basically kind of like a home remedy guide, sort of like before there were PDRs, physician desk references, or Google to find, Dr. Google to find information. You had these books that were typically rooted in what we would consider something like herbal medicine, alternative medicine, or homeopathy. Now, in general, plain people enjoy very, very good baseline health, especially immune health. It's kind of a Green Acres, sort of lifestyle consequence that comes from it. They get a lot of physical activity, many steps a day, many thousand steps a day on average, essentially no screen time. And thinking about kids and limiting screen time, well, plain people have it all kind of figured out because within their communities, they essentially have zero screen time. Their diet is very much kind of farm to table. Rural living in general is conducive to good health. Very little tobacco and alcohol consumption, which doesn't really bring any health benefits. So if you can minimize that, then you're doing pretty well. There's been a number of scientific studies about plain people, the Amish in particular. One thing that's been pretty exciting, and again, I've been grateful to learn from a pediatric immunologist who's at UW Health. I've learned so much from Dr. Saruji. One of the things is the lower rates of asthma and allergies that are found in general, many rural populations, which is kind of a combination of sort of nature and nurture, some good genes in there with some good natural exposure to early triggers that to natural resistance of allergies, including asthma. There's also studies that indicate that sort of the big three, cardiovascular disease, diabetes, and cancer rates may be lower among plain people than in the general population. This translates to, in general, very high life expectancy. Plain people have lived relatively long, healthy lives for quite a while. The rest of American society has sort of caught up, although there's been sort of a blip downward since COVID, and in some cases, other sort of social differences between plain and non-plain people that have led to somewhat lower life expectancy among non-plain North Americans. There's also some evidence to indicate, not clear yet, that perhaps infant and maternal mortality rates may be lower among the plain people than in the general population. In terms of genetic health, I've already made some reference to that. Plain communities are closed communities, which means that you have the so-called founder effect, that basically everybody is related to one another, although not necessarily closely related, but at least distantly related. Now, that certainly means that higher risk of you're more susceptible to getting an inherited genetic disorder. That would be on the sort of bad genes. But keep in mind that you can inherit good genes as well. And there are genes that kind of protect you against illness, and in some cases maybe may extend your life. And there's some fascinating studies done by geneticists working with plain communities, and the Amish in particular. But anything that has to do with genetic health, there are certain challenges that are posed of diagnosing and treating what are in some cases very, very rare disorders. Like, for example, SCID is in the human population relatively rare, right? But if you're living in a rural area, you don't necessarily have easy access to specialists or to healthcare providers that have a lot of experience with working with some of these quote unquote more exotic disorders. This is why the field of so-called translational medicine is so important, kind of bridging the gap between providers, especially in smaller facilities, and research institutions globally. And then finally, one thing that is a very, very important aspect of plain health culture is that they very, very strong family and community stability. I mentioned the watchword of, self-reliance as a community and what I call a culture of care. When it comes to preferences for care, overwhelmingly, the quote unquote natural route is what plain people prefer, what we would call, say, complementary and alternative medicine. There's a strong preference for going natural, right? Meaning, like, if you could avoid medication and surgical interventions, that would be preferred. When it comes to pregnancy and childbirth, home births are overwhelmingly preferred. In Wisconsin, it's something like 90% of plain births are at home, attended by midwives, either licensed or lay midwives. A strong aversion to C-sections, which are probably overprescribed among humans generally. Not just plain people. strong affinity for chiropractic care. I mentioned the B&W Burdock burn and wound therapy, which is was developed really only kind of starting in the 1980s and then sort of codified in the 1990s. But with every year, there are more and more people, overwhelmingly plain people, who are trained in this therapy and are administering care to their fellow plain people, and in some cases, non-plain folks. And then finally, a very strong preference for nutrition, vitamins, and supplements, which is kind of what you would expect for a group of people that are drawn to complementary and alternative medicine. There's, in general, sort of there's no sort of like prohibition against conventional medical interventions, but in general, people prefer blending complementary and alternative medicine with so-called Western or conventional medicine. Vaccine hesitancy or skepticism, not necessarily outright resistance, but at least a caution, skepticism about vaccines is very much a reality among plain communities, and it's something that is ramped up since COVID. There's no question about that. Now, you'll see a lot of books like this on a lot of plain shelves. Be your own doctor, be your child's pediatrician. These are two books that were written by the same person. This was a Mennonite woman, a plain Mennonite, who the initials after her name, Rachel Weaver there, MH, Master Herbalist. And she began her career as a midwife and then developed a very strong interest in herbal medicine and then was known as a very, very skilled provider within the community. And she wrote these two books, which are not limited. You don't have to be plain to buy them, but they're things that are I think useful for anybody that's interested in sort of a kind of complementary and alternative approach to healthcare. And the books as I say, are widely popular among plain people. Just we can talk about the details of the B&W Burdock therapy, but if you simply Google B&W Burdock and maybe put my name after that, probably the fourth or fifth entry in Google, you will find a web page that I created that has information on the B&W Burdock therapy. In the middle there, you actually see the salve. It's a honey-based salve. In the little tray there, you see some leaves, burdock leaves that are soaking. The salve is administered to the leaves, and then they are applied to the wound instead of using gauze for it. Gauze is just used on top of the leaf dressing to hold the dressing in place. But there's some pretty amazing success stories that come from the B&W Burdock therapy. And on the webpage that I've created, there's actually links to a 5-part YouTube video training session for the therapy that was made with the permission of the Amish that were conducting that session. So in terms of challenges that healthcare that plain people have when they access outside healthcare, really the main one is financing, because plain people on religious ground refuse to purchase health insurance or accept government assistance. Now, there are some, this is definitely true of the older Amish, older Mennonites. There are some plain groups that would be considered sort of in between non-plain Mennonites and plain Mennonites. So they, the women wear coverings, they dress distinctively. They would be in some cases, more accepting of government assistance and would purchase health insurance. So it's a little bit variable there, but definitely among the old orders, purchasing private health insurance or accepting government assistance is really something that they rule out on religious grounds. That means that they're paying out of pocket, but as they say, we want to pay our fair share, just not more than our fair share. And so they typically seek very fair discounts and package deals with healthcare providers. This is not something that works very well in the U.S. healthcare system. Uninsured folks are really kind of at the bottom of the totem pole when it comes to dealing with paying for healthcare. So there are problems. We could talk about details in a moment, but just to give you a few phrases here, so-called wallet biopsies, when patients are decided to be accepted for care on the basis of their ability to pay. And then a word that it's an uncomfortable word if you're dealing with healthcare financing, which is charge master. Charge master is the term that's described basically the sticker prices that healthcare providers charge as the sort of starting point for negotiations when working with either individual patients who are uninsured or insurance companies. A second area of challenge of accessing health outside care has to do with communication and transportation because plain people generally avoid electronic communications. That means that they wouldn't have access to healthcare software like MyChart. For the Amish, their telephone use is typically not personal; it's community phones. When it comes to transportation, if you have horse and buggy and you don't own or operate your own motor vehicles, just getting to appointments, hospitals, that kind of thing means that you have to hire drivers, which is costly. And there have been some situations that I've been involved in where self-pay patients, specifically Amish, have been discriminated against by ambulance services for the fact that they're suspected of not being able to pay. So there are some factors that I've noticed that can shape negative views of plain people, specifically among healthcare providers. And first is that there are some, in general, the concerns always have to do with pediatric patients, with kids. And, child neglect and abuse in U.S. society are realities. And so when children, appear to have been, are injured in some way, there's often a red flag that's raised about whether they've been neglected or potentially subject to abuse. There's also, I'd say, on the part of a lot of Americans, a kind of suspicion about conservative religious groups, and in some cases, an equation of conservative religious groups with cults. There are also some basic, kind of, fundamental negative stereotypes, in some cases not corresponding to reality or maybe having a very, very tenuous connection to reality. But, in particular, associating conservative religious groups with those in particular that limit access to some extent to formal health care, which would include, say, Jehovah's Witnesses and blood transfusions, as well as Christian Scientists. And certainly there are a lot of negative stories about plain people in the media, right? So a lot of popular media coverage about plain people is often exoticized and negative. So stories about youth running wild, church discipline, known as shunning, which is an extreme form of discipline, and certainly abuse. Um, and there are some aspects of plain culture, the health culture that we've talked about, that can arouse certain, degrees of suspicion among providers. Just simply preferring complementary alternative medicine may make some providers a little bit uncomfortable because they haven't been trained at. When plain people start asking questions about costs, right? That's something they think, well, is your kid, what's more important, your kid's health or paying for it? And, people will say, well, of course my kid's health is important, but I'm also concerned about, if I've got to pay everything out of pocket, is every, for example, test that you're going to recommend or require, is that absolutely necessary? And what is it going to cost? In general, plain people, especially conservative Anabaptists, traditional Anabaptists, are more accepting of death and trusting in God's will. It's referred to as yielding to God's will. Pennsylvania Dutch word is the than many folks in the social mainstream. There's also a belief among all Anabaptists, but very articulated among plain Anabaptists, that if a children is to die, that child's salvation is assured. Right? That's part of the theological basis for believers' baptism. It's not necessary to be baptized to gain salvation. There's also a strong inclination among a lot of plain people to decline pain medication. Some cases concern about opioids, which is not a misplaced concern, but that can be, somewhat, could be a potential red flag among certain providers that are not familiar with plain culture. There's also a reluctance on the part of plain people, especially women, in public interactions to speak up and ask questions. And the reliance on sort of community leaders, often referred to as elders, as spokespersons who are universally male. That's something where they think, oh, are the elders making decisions for a family or for a particular patient? Or is there any kind of patient agency that's going on there? And in general, plain people don't wear their emotions on their sleeve. So when they're, even if they're suffering in a very, very, strong physical or emotional way, they tend not to be very have wear that on their sleeve to be very outwardly expressive. And that leads some providers to wonder, do they really love their children if their kids are sick? And they say, well, we certainly love our children. We're just not going to be so outwardly expressive about that. And then finally, the fact that plain people limit formal education to eighth grades is also something that can sometimes feed into negative perceptions of plain people when they're interacting with the healthcare system. So by way of kind of strategies to improve communication with plain people and providers, here are a few that I've gained over the years. Building relationships is important, but especially in non-critical situations. So not dealing with a particular patient or a particular, immediate situation, but sort of speaking offline, whatever, building relationships between providers and plain communities. Um, Forming committees, plain communities have often relied on sort of appointing members of their community to serve as kind of a mediating force between themselves and outside agencies, including healthcare providers. You find these, committees at the community level, state level, and the national level. Been a lot of positive effects that way. It's There have been wonderful information sessions that have taken place between community members embedded in communities, so like say at a local fire hall. So when you invite healthcare providers, so nurses and doctors and midwives and chiropractors and so forth, as well as first responders and social workers and anybody on the outside with an interest in healthcare topics to meet with community members. On the other hand, it's great for plain people to often uh, offer to come to healthcare facilities, especially, say, tertiary facilities like big hospitals, to meet with the providers and social workers on site. And then finally, it's highly preferred if when say a plain patient is at a say, tertiary facility, so like a university, like our university hospital, American Family Children's Hospital, that they also have a kind of advocacy in the form of nurses and physicians in their local communities, or say at smaller clinics, who can serve as patient advocates. So the second area, and I will move through as efficiently as possible. Aside from healthcare, it's fewer slides here talking about legal situations. There's a certain amount of overlap between what I've shared in terms of strategies to boost communication between plain people and non-plain communities. But I will sort of say, from a historical perspective, that interactions between the ancestors or the spiritual ancestors of today's Anabaptists and the state have not necessarily been good. So in the early, generations, so about 150 years from 1525 forward, most of the interactions that plain people or Anabaptists had with state authorities were quite hostile and negative. And there's a reason why Anabaptists were then and still in certain circumstances inspired to migrate. And so there's lots and lots of really, really, in some cases, horrific stories of martyrdom at the hands of the state, which is kind of, I won't say that it's kind of baked into plain culture, plain Anabaptist culture, but it definitely colors their view of state authority and doesn't necessarily, promote trust. So most interactions between plain people and the legal system involve civil cases, so not criminal cases. So I mentioned before things that have to do with like building and zoning regulations, insurance disputes, and say vehicle and buggy, road safety questions. Crimes that are committed either by plain people or against plain people are overall quite rare. But in recent years, there've been there's been a lot of popular media attention on true stories of domestic and sexual abuse. And on the sort of positive side of reaction, even coming before Me Too, many plain community leaders have started to recognize the need for outside support in addressing abuse and ideally promoting a culture of prevention, realizing that abuse is so complicated as to really go beyond what they are able as a community to address themselves. And particularly this cardinal virtue that I've mentioned before, forgiveness, but also love for one's enemies and non-resistance, non-violence, which I've talked about before. These core virtues at the heart of plain Anabaptist life and how they translate their faith into everyday living can lead to a reluctance to actually go to authorities to report crimes and certainly to hire attorneys. Now, in terms of civil cases, there have been some very, very interesting disputes that have involved, legal questions of religious freedom. Probably the most current one has to do with it occurred in Minnesota. It was resolved just last summer, where the most traditional or most conservative Amish group, known as the so-called Schwarzentruber Amish, refused to install septic tanks for the management of gray water, which is like bath water and dishwater and that sort of thing, saying that it was against their particular Ordnung or code of regulations, rules and regulations for their particular community. And there was a lot of pushback, and it went on for over a decade. So that started in 2013 and was resolved only finally last summer. And the U.S. Supreme Court was involved briefly, but also the Minnesota State Supreme Court. And it was resolved positively with some great interactions between, environmental engineers and plumbers and community members. And this just gives you a little, for folks that were interested in a little bit more kind of a nerdy perspective on how they manage things. And it was basically an alternative to using septic tanks and going with a more natural so-called mulch bed approach with certain natural basins. The last thing I'm going to be talking about is abuse. I mentioned that there's been a lot of popular attention, a focus on stories of abuse. Probably the most widespread or popularized story was appeared in Cosmopolitan magazine about 5 years ago. And you can just tell from the title and the subtitle here, there's a lot of sensationalism. The Amish keep to themselves and they're hiding a horrifying secret. A year of reporting by Cosmo and Type Investigations reveals a culture of incest, rape, and abuse. Now, you're basically saying that to be a plain person is to be a member of a culture that promotes incest, rape, and abuse. And that is simply too extreme to be correct. Now, do incest, rape, and abuse occur in plain communities? Yes. Are there certain aspects of plain culture that make it challenging to address and prevent cases of incest, rape, and abuse? Yes, that is true. But to say that to imply that somehow it's a natural consequence of plain culture is simply false. There are outside organizations that consist in many cases of survivors of abuse who grew up in plain communities, who are doing very, very important work to raise the awareness about seeking outside help when victims are experiencing abuse. And one organization that I've had contact with, it's based in Minnesota, is known as Amish Rescue Mission. And this is an example of their a poster that they have. They also have that translated into Pennsylvania Dutch. But talking about forgiveness, forgiveness is something that is kind of, people think they know what the term means, but forgiveness is something that is kind of not necessarily well understood as it's practiced by plain people. And kind of in a nutshell, the way that plain people understand forgiveness is that it is simply foregoing your right to revenge. So in other words, not seeking revenge or, wanting to get even or to pursue sort of an eye for an eye kind of approach. It is the first step in a process of what we'll call restorative justice. Now, restorative justice is something that's widely familiar in sort of mainstream American culture, even if it's not necessarily widely practiced. But a lot of sort of mainstream Americans or outsiders understand forgiveness as being something different. They understand it as sort of like excusing or condoning or forgetting or moving on. And that's sort of the last step in a restorative justice process. For plain people, they say, okay, first off, I've got some recovery to do and there's got to be some repair that happens. The first step is to simply say, this is not going to be about getting even. This is not about seeking vengeance or revenge. And now we'll move on toward healing. That's how plain people understand forgiveness. It's not excusing, it's not condoning, it's not forgetting. A lot of books that have talked about this. This is, another one of many books popularly available by a very, very gifted writer, Suzanne Woods Fisher, called The Heart of the Amish. And I'll just read the subtitle here. The Amish believe that to forgive an enemy, so contrary to human nature, is to follow Jesus' instructions on forgiveness as well as his example. And they don't just seek to forgive, they also love and bless those enemies. So loving your enemies, right, is something that's a real challenge, but it's something that has a very, very clear scriptural basis for plain people and other Christians. Here at UW-Madison, we are fortunate to have on our faculty Professor Robert Enright, who is a world's authority on the concept of forgiveness. And his definition, I think, is very, very useful here, coming from a kind of, psychological perspective. When unjustly hurt by one another, we forgive when we overcome the resentment toward the offender, not by denying our right to the resentment, but instead by trying to offer the wrongdoer compassion, benevolence, and love. As we give these, we as forgivers realize that the offender does not necessarily have a right to such gifts. So I won't, there's a number of things that we can get to. I'm going to move quickly through the final slides here to be able to wrap up. But I just want to indicate that there are actual health benefits to forgiveness. This is a screenshot that's taken from the Mayo Clinic website, right? And it points to how actually this kind of, peace of mind that comes from forgiveness can lead to healthier relationships, improved mental health, less anxiety, stress, and hostility, fewer symptoms of depression. It can lower your blood pressure, potentially strengthen your immune system, improve your heart health, and improve self-esteem. So I'm going to move relatively quickly here. I won't talk about too much about sort of the correctional system in detail, but I just want to point out that plain communities seek to address problems, kind of within their community first. Now, they don't deny the necessity of interacting with things like law enforcement and the judicial system, but this is a chart that shows, as kind of a modified version of sort of how corrections are understood in this country generally. And there's kind of 5 pieces to the puzzle that they're incorporated in sort of 4 parts here: restitution, rehabilitation, incapacitation, and deterrence and retribution. Restitution, sort of paying back, is something that is just simply, a very common concept in the American judicial system. It's something that's non-existent, right? So it has to do with sort of the forgiveness piece among plain people. And retribution is definitely off the table. And so there are ways that communities have developed to kind of offer an alternative to state-based corrections. And again, we could talk about the details in a moment, but I just want to kind of share that image with you. And then finally, I want to share some final remarks about how abuse situations in particular can be addressed for plain communities. It's incumbent upon them to learn more about abuse and the resources to address and prevent it. For outside professionals who interact and serve plain communities, gaining knowledge about plain faith and culture, including this tricky concept of forgiveness, I think is important. In the same way that sort of like having, developing relationships outside of a particular situation or a non-critical situation that I mentioned in healthcare before, that applies also in dealing with abuse situations. So especially for social workers, getting to know plain families, again, not in a particular, dealing with a particular case, but just sort of getting to know them and offering their services. And then abuse awareness meetings that include outside professionals. These are already happening in plain communities. And then finally, connecting with mental health professionals and creating treatment centers, inpatient facilities. And by way of concluding thoughts, I will offer these. Plain populations are growing exponentially. Their populations are doubling every 20 years. That means that contacts between them and outsiders and outside organizations are almost, guaranteed to increase. Now, what I call the doctrinal bedrock of plain Anabaptism, remember those core Anabaptist values that I talked about before, that's largely unchanging over the last 500 years. But on the other hand, plain cultures have always changed. They've always been evolving in response to interactions with other groups, and that includes outside organizations. And as plain groups have what sociologists call negotiated with modernity in areas like, say, technology and education, how they interact with the healthcare and legal systems requires what I call mutual thoughtfulness. So thoughtfulness on both the sides of the outsiders and the plain communities, as well as mutual respect and mutual openness to accepting new ideas. So plain people learning from outsiders, but also outsiders learning from plain people, right? And maybe kind of changing their worldview about how they, say, deliver healthcare or practice the administration of justice. And then finally, in general, I think that building dialogue and especially like personal, first name basis relationships of trust in non-critical situations can and does lead to outcomes that benefit both plain people and the larger society in which they live. So with that, I will stop sharing my screen and open things up for questions.
Thank you so much, Mark. That was really interesting, fascinating, actually. I'm, yeah, delighted to see some really great questions already. Stan Kaufman asks, is Low German the same thing as Plattdeutsch? Could you maybe say a little bit about what Low German Plattdeutsch is and why it's
Yeah.
spoken by these particular groups?
So Low German is a general term that is Plattdeutsch is the correct word for that, or Niederdeutsch in German. But there are hundreds of different varieties of Low German. So it's not just one type of German dialect. And the particular dialect that Low German speaking Mennonites speak is something that is actually no longer spoken in the area of North Central Europe, Northern Central Eastern Europe, where their ancestors lived for quite a while in what was called West Prussia. So it's one among hundreds of different Low German dialects spoken, but it is also Low German is also called Plattdeutsch. That's correct.
Great, thank you. On a completely different topic, Valerie Metzler says, we have maple syrup urine disease here in Pennsylvania. Is it seen in the Midwest? Have you encountered
Yes.
that in your
Yes. Among overwhelmingly old order Mennonites. I don't believe, maybe some of my genetic medical colleagues would be able to confirm that it's not been identified among Amish. I don't know about that, but it's definitely something that I've been familiar with among old order Mennonites. And so there are old order Mennonites in the Midwest who in most cases have come directly from southeastern PA, from Lancaster County, Pennsylvania, or other parts of Pennsylvania and are related. So yes, it is here in the Midwest.
Okay. Yeah, and Sam Boucher wants you to take you up on your question earlier. Can you say more about the lost limb story?
Yeah, this was an interesting story. So this was a gentleman that lost his hand in an accident, and I won't say how it was severed, but it was completely severed. And he was at a place of work when it was severed. The EMTs came and retrieved him and the hand, put the hand on ice, and took it to here to Madison, to UW, in the hope that they might be able to reattach it. They were not able to reattach it. And so, the guy, recovered, they did surgery or whatever, and he had a follow-up appointment in the clinics. And, he was hospitalized for just a couple of days. And he had said, I'd like my hand back, actually, to the providers. And they said, sure, we can do that. But at discharge time, they said, it's probably too complicated or whatever. You've got a clinic appointment coming up. You'll get it then. And the reason that he wanted it was that he was a young guy, and he had heard stories partly from his father, but also increasingly from other males who had lost limbs in accidents, that there's a risk of so-called phantom pain. Right. So in other words, you've heard these stories of like, somebody's lost a limb and if they feel like an itching or a tingling, or maybe in some cases actual pain, where the hand or the foot or the leg or the finger or whatever it would be. And so he was recommended to retrieve the hand and bury it. And he was becoming increasingly anxious that he was not going to get the hand back, because at his first clinic appointment, first follow-up appointment, he got what he perceived to be a runaround. And the people, that were, examining him and said, oh, yeah, we're not exactly sure, but, we'll look into it or whatever, you've got another appointment. And so finally, second appointment happened and he got no hand back. And so that's when he called me. I had already talked to his dad about the accident. I was familiar with the case. And his dad said, Mark, would you please figure out? I mean, if they've disposed of the hand, at least let us know. But tell us what's going on with the hand. And so I called or texted a surgeon friend of mine who's involved in burn and wound care. And I said, so what happens with limbs? He said, well, that falls under the category of specimen. And he said, typically they are, not returned to patients. He said they may be held in pathology and then they're incinerated. And so he did some calling, and sure enough, it turns out that that hand was still in the pathology department. So it was actually still on site. But the catch was that the pathology would not release it unless it was to a funeral home. So you can't just go out with your leg or your hand or your arm or something like that. It has to be retrieved by a licensed funeral director. So then I talked to the guy about it and I said, "What's the funeral home that you work with?" It's this group in Baraboo. And so I said, "Do you want to call me?" He says, "No, you call him, Mark. I don't know how to talk about this or whatever." So I called the funeral director and was like, "Hello," and arranged to have the hand retrieved and that sort of thing. But as it turned out, at the third clinic appointment, the pathology department decided it was small enough to put in a sort of small container, and so he left with it. And I got a call from him on the van driver's cell phone on the way back. He said, "Hey, Mark, I got my hand." And he said, "It's like it's an ice cream bucket." That's the way that he described it. And then he went back and he buried it. So,
What a story.
yeah,
But
yeah,
it also illustrates the different attitudes towards injuries like that and the
no,
whole
no,
regulatory system that exists in the
yeah.
medical field and so on. Wow. Uh, yeah, David Altman says this is an excellent presentation, and then he has a number of really interesting comments. I will point out a few of them here. He says he himself is of South Dakota, Kansas, Mennonite, and Amish background, back from Europe on both his father's and mother's side. And when his son underwent genetic testing, it came back mostly clean, except for a check mark indicating an Amish syndrome. I don't know what that is, but David points out that recessive genes can persist for centuries. He also wants to mention that there are a number of Hutterites who do not live in colonies in South Dakota and consider themselves non-plain.
Hmm.
And then he also mentions a book by Lauren Friesen and Dennis Kuhn for a broader exposure to Anabaptists in general. The title is The Anabaptist Remixed: Varieties of Cultural Engagement in North America.
Excellent book.
I leave this up here for everybody to read. Thanks for those
Excellent book.
comments,
Yep.
Dave.
Great feedback. Thank you.
Yeah. And on to some more questions. Karen asked, is forgiveness associated with karma?
No. So karma would be, coming, I understood it correctly, karma, Karma,
Yes,
right?
that's
Right. No, that's not something that would be part of Anabaptist Christian spirituality. So no.
fine. Okay. Then Doris asked, to your very last bullet point, how can those trusted personal relationships be cultivated when plain people value separateness? Whether general approaches or specific examples you have seen that succeed?
Great question. So plain people are very social people. They socialize with one another, but they also socialize with their non-plain neighbors. They don't live in sort of distinctive, like, vacuum sealed communities. And so they all have non-plain neighbors. They interact with them. And so the best relationships that I've seen are actually just simply, people getting to know one another as neighbors, as customers at Amish businesses. Most Amish nationwide, including in Wisconsin, rely on small businesses for their main sources of income rather than on farming. So they're coming into contact with non-plain people all the time. Now, as long as it's not sort of like going in with a camera, or, video camera or something like that, and, treating, plain people as sort of, exhibits in a zoo, in the same way that you would develop, personal relationships with other neighbors, um, you know, give them a ride somewhere, maybe invite them over for lunch or dinner, um, you know, ask them for a recipe for a particular cake or cookie or something like that. But these, plain people are very, very social and value the relationships, the friendships that they develop, not just with other members of their community, but also with outsiders.
Mhm. Yeah, good points. But by definition, I guess since they are restricted to a certain geographic area, the contact would happen in that area. more likely.
For the most part, I mean, in general, they value face-to-face communication, face-to-face relationships. There are no words in Pennsylvania Dutch for Mr. and Mrs., right? It's all first names. And so, that's this, it's a kind of a nice, it's a sort of a traditional way of fostering relationships, is like getting to know people personally. And another thing that I've often said in healthcare with healthcare providers is like, there's no word in Pennsylvania Dutch for HIPAA, right? For, privacy, that kind of thing. Because they're constantly saying, hey, my cousin was, seen by you last week, and let's compare notes or something like that. Providers are like, oh yeah, right. So I mean, a lot of providers that work with plain people, get used to the fact that there's not as much kind of private information among plain people, including about healthcare, um, you would expect in sort of the mainstream. And so again, it's just, there's a real warmth that comes with having these personal connections, and I would say sincere friendships between plain people and outsiders.
Great. Yeah, Chris Wickham asks, is there an awareness in Gaines County, Texas, where aversion to vaccination is strong in the Mennonite community, that there's a responsibility to the wider community to help eradicate measles? If so, how can this be negotiated?
That's a question not just for the Mennonites of Gaines County, but for all vaccine skeptical and hesitant populations or individuals. That's the $1 million question there. Um, and I don't have a good answer for that. I just, this is kind of what's at the heart of vaccine skepticism. And this is exactly, Chris, it's exactly the right question to pose. And they're not easy answers to that.
Yeah. Kind of in the same way, in plain people and modern medicine and healthcare, Peggy House comments, in 2021, I met a traveling nurse who had been doing a lot of work in ICUs in the Oshkosh area. She took care of a number of plain people who had COVID. I was surprised that plain people were willing to use that level of technology, ventilator, all kinds of monitors, IV medications, etc.
There are no limitations on medical interventions whatsoever among plain people other than elective abortions, right? That's the only thing that's sort of off the table. There are a small subgroup of the so-called Schwarzentruber Amish, these highly conservative Amish that I mentioned in connection with Greywater in Minnesota, that decline open heart surgery, right? That's there, but basically no, medical intervention is completely off the table. And so even though they're less likely to access it if it seems unlikely to lead to a positive outcome, right? So if not, pulling out every imaginable stop to save a patient's life or something, they will accept. There's nothing, where they're going to draw the line and say, no, don't put me on a respirator, simply on religious grounds. There just is not that sort of religious basis for declining medical interventions.
Mm. Haruka Whitcroft asks, how about education? And I actually want to add on her question a little bit. She wonders if Amish education philosophy is similar to Montessori philosophy. That's currently a trend among parents in this country. And I also want to add a side question. Is actually healthcare or health class taught in Amish schools? And if so, what would be included in that kind of curriculum?
So two really, really good questions. I'm not really familiar with the Montessori philosophy firsthand because my daughter didn't attend a Montessori school. But I sense that there are some parallels because collaboration is emphasized much more over competition, right? So that's one thing. So the typical Amish community or plain community school is modeled on the so-called one-room schoolhouse method, right? Which is traditionally, depending on the number of kids, all 8 grades in one room. And what that means is not just like you've got, like dividers between 1 and 2 and 3 and 4 and so forth, is that there's a lot of like third graders working with first graders and first graders reading to fourth graders and eighth graders helping out, so, that kind of thing. And so, yes, they do have grades, but there's nothing like, grade point averages and class ranking and that sort of thing. So very much de-emphasizing competition in favor of like, you just do your best kind of thing. If that's in line with Montessori and other kind of progressive educational values, then I would see that as a clear parallel there. The second point, the question that you added on there, Antje, about health education, basically, no, there's no health curriculum. I will say that a lot of Plain kids get what I'll call practical biology simply by growing up in close proximity to nature and especially animals. So, breeding animals, reproduction, basic birds and bees stuff, these kinds of things. As I say, kind of practical biology is something that is just part of the experience of growing up in a rural and particularly plain community. But typically, I'm not familiar with any curriculum that actually has like a health component built into that. That being said, there are things like burn prevention, farm safety, information, things like basic first aid, right? That many kids learn, but it's usually like a particular workshop, or it may be something that's not just for the school kids, but it's at the schoolhouse on a Saturday or something. So CPR, many learn CPR
Yeah.
actually too.
Thank you. And then Karen asked a question that I also got from other sites on email, so I will answer it. Will this be recorded? Yes, it's recorded, and I will put it online in about a week or two and send out a message when it's available. Valerie wanted to know, going back to David's comments earlier, what is Amish syndrome?
I'm not sure what that refers to
Yeah.
because there are several genetic or inherited disorders that are more common among the Amish than in certain Amish groups than in the general population, but there's nothing that's unique to the Amish as far as that goes. And I don't know that there's something that's particularly called Amish syndrome. Um, I'm kind of skeptical about that term, actually.
David Hünlich asked, what challenges do plain people face with regard to exponential growth?
Availability of land is one thing, but there's still enough. So like in a place like southeastern Pennsylvania, it's kind of maxed out as far as like within Lancaster County about, you can't subdivide these farms anymore. You can't, expect necessarily if people want more land to be able to stay in close proximity to Lancaster. But, you know, with the expansion, the exponential growth of plain populations has been a depopulation of rural America generally. And so basically what they're doing is kind of moving into areas that have been have historically seen depopulation. So now plain people are Amish, just Amish in particular, are located in 32 US states and 3 Canadian provinces, and there's still plenty of space available for them to expand. So they are much more mobile than a lot of people would assume. They're not necessarily like Ortsfest that they have to stay in, southeastern Pennsylvania. They've moved or elsewhere in Ohio and so forth. They are much more mobile than a lot of people would assume. And that's basically how they've kind of reacted to that. They've expanded into areas where there's still land available.
Okay. Greg Taylor asks, is there a term in common use for us among Amish communities?
Generally English, right? Sort of for the use of the English language. But it's interesting. The term English has nothing to do with ancestry, and it doesn't mean that you're necessarily not even of Amish background. Because I've had, like, for example, I was chatting with an Amish kid once, and he said, "Yeah, I've got an uncle who's English," right? His uncle had grown up Amish and spoke Pennsylvania Dutch and that sort of thing, but he was no longer a member of an Amish community or even an Anabaptist community. He said, "Yeah, I've got an uncle who's English." So English is the most common term there. In Pennsylvania Dutch, there's also the term die hohe, the high ones. Not necessarily like, oh, high status or a high class, but there is this kind of folk cultural hierarchy where the most traditional, most conservative groups are referred to as niddle, as low, and those who are more progressive or closer to the mainstream are called high. So especially among Midwestern Amish, they refer to outsiders as the high ones.
Okay.
Another term that's out there.
Do they have a term for all Amish groups or plain people? What do they call themselves?
Plain people.
Plain people, yeah.
Plain people, yeah.
Yeah, and maybe one last question from Sue Barker. She says, I saw a news story a while ago where someone was claiming to have successfully worked to get out the Pennsylvania Dutch vote last November. Is this a new development? I guess
No,
so.
Fake
Amish
news.
being fake news. Okay.
Fake news. Yep, not true. So there's a political scientist and a sociologist that have worked very, very closely to kind of track voting records in highly concentrated Amish communities in Pennsylvania in particular. And they did the analysis in 2016 and 2020, and they found that the rates of turnout were not dramatically higher than they had been in the past, which is quite low. And already the preliminary results for 2024 show that in Pennsylvania in particular, that the Amish vote, and assuming that every single Amish person voted Republican, which is not unreasonable to assume because historically they tend to vote more toward the Republican Party than the Democratic Party, it didn't come close to making a difference in the number of in the popular vote that gave it for the Republicans in Pennsylvania. So no, it's not true. But that there was a pack that was formed already, I think in 2016, that's targeted Amish in especially Pennsylvania and Ohio. They're swing states, and it was in reality not successful. But that's not what you hear in the people that
Hmm.
promote that.
Um, yeah, David actually gave a website here for some Amish Mennonite and Hutterite genetic disorders, a database link. And then Danielle asked, what is the difference between Pennsylvania Dutch and Dutch? Original Dutch, she said, Dutch language, I
Great
guess.
question. So the word Dutch in Pennsylvania Dutch does not go back to a translation of the German word for German, which is Deutsch or Deutsch. The words Deutsch and Dutch are historical cousins to one another. And in English, the English language, the term to describe what Germanic speakers on the continent of Europe, south of Scandinavia spoke, so what we would call basically Netherlandic and German today, they just call it all Dutch, right? And so if it was in the northern areas where it's the flat elevation, like the Netherlands and northern Germany, they called it Low Dutch. And then you go down farther south to a place like Switzerland and it's High Dutch, right? Those were the English terms. Dutch for basically Dutch and German, what we call today Low Dutch versus High Dutch. The word German is actually a Latin derived word that entered the English language somewhat later. And so it's kind of displaced the old word for German or Germanic, which was Dutch. So that's where that comes from. So it's, the language of the Netherlands and part of Belgium is Dutch, Netherlandic. It's not closely related to Pennsylvania Dutch, whose origins go back to a group of German dialects that were spoken in southwestern Germany.
Thank you. Yeah, and Peggy says, fascinating presentation. You gave us so much to think about and explore further. Thank you. I think that is a perfect closure. Thank you, Mark,
Well, thanks everybody for coming.
for a
Appreciate it.
fascinating presentation.